Welcome. Today we are going to talk about a small case, and this is a case of a limping child. So we would use this case study to differentially diagnose the causes of a child who's got a limp, and we will go through some of the investigative modalities, some of the causes, and how to treat a child who presents with a limp. So let's start with this case. So this is a 3.5 years old child, male child, who was brought to the hospital with a 1-week history of limp, and this limp has now gone worse. So it started with a mild limp and now it has become severe. The mother says that there is no history of trauma, so the child didn't suffer any injury, there's been no history of fever, and there has been no history of preceding viral illness like an upper respiratory tract infection. The mother also says that he hasn't got any past history of joint problems, or he never had a limp in the past. So this is the first time that he started to limp, and now it's been 1 week. So the mother said that she thought initially that because he's a kid, so he might have injured himself while playing somewhere, and she thought that giving her a bit of rest and giving him some painkillers would take the limp away. But she has noticed that the limp has persisted, and now he can't even run for a few yards because of the pain, and the limp has gone worse. And now when he's walking, the mom said that she has noted that the left foot is slightly turned outwards. The past medical history has been fine. He's fully updated with the immunizations. He lived with his mother and his father. The socioeconomic history is good. There are no known drug allergies. So in general, the child has been in generally very good health. Now on examination, we found that this is slightly obese child. So it's a bit healthy for his age. And when he is brought into the examination room, I noticed that he is walking with an antalgic gait. So he is limping. It's not a uniform gait. He's slightly deviating to one side with his foot slightly rotated to the left side. Now being put on the couch and checked for a leg length discrepancy, we found out that both legs are of equal length, so there is no shortening of one lower limb. He hasn't got any tenderness anywhere along all the joints of his left or right leg. He's absolutely fine. There are a few old bruises which are visible here and there around the knees, but obviously, you know, a child who's of this age, they play around and they get bruises. And when his joints are checked for range of movement, whether it's the ankle joint, whether it's the knee joint, whether it's the hip joint, so all the joints have got good range of movements. He's not complaining of any pain anywhere along the joint. So moving on, we tried to investigate, and because there was no obvious signs of external injury, we thought to start with hip x-ray. So he was sent for an imaging, and we requested an x-ray of the pelvis, an x-ray of the left hip, because we thought it was the left side, and a frog view of the pelvis was also requested. Now here you can see the x-ray of the pelvis of this boy. This is a frog view, and if you notice here, there is something quite interesting. Now if you compare, now this is the right side and this is the left side. And if you compare the hip joint, now this is the hip joint of the right side and this is the hip joint of the left side. Look at the space. So this is the joint space. Now the joint space here is a bit widened as compared to the right side. So you see that there is widening of the left hip joint space. And then if you compare the head of the femur in both cases, look at, here is the head of the femur, and if you look on this side, this seems quite flattened as compared to the other side. So you see there is flattening of the head of femoral bone here on the left side with increase in the joint space, and this means that there has been some form of bone reabsorption. And given the fact that this age, 3.5 years, close to 4 years, with a painful limp, with a widening joint space, hip joint space, and flattening of the femoral head goes with what we call as leg calf Perthes disease, which is also known as the avascular necrosis of the hip joint. Now, this disease is common in age group 4 to 8 years of age, and because of some reasons, what happens is that the blood supply to this area gets cut off for one reason or the other reason, and that leads to less blood supply going into the femoral head. So there is a lot of bone reabsorption, and what happens is that under the body weight, the femoral head collapses down. So as it collapses down, then you've got left articular surface, and obviously that leads to inflammatory changes as well. So there is a painful limb. So this was a classic case of leg calf Perthes disease, also known as avascular necrosis of the hip joint. So this child was referred to orthopedics, and obviously he was advised bed rest, and rest of the management was left to the specialists, that were the orthopedic doctors. So that also brings us to a very important discussion that when a child presents with painful limb, what are the differential diagnoses? How do we approach these kids? What is the workup, and what is the treatment? So the differential diagnosis of a limping child can be broadly, or in very simply, can be divided into two categories: whether that limp is painful or whether that is painless. It's very important, because if a child is limping and he says he's got pain somewhere along that lower limb, then that by definition becomes a painful limb. But if the child is not bothered with the limp, I mean he's limping but he's not complaining of any pain, then that would be called a painless limp. So let's start with painful limp, which is more common as compared to the painless limp. Now, obviously, you have to ask about trauma. Trauma is the most common cause of painful limp. Kids who are playing around, they usually bump into one another, they fall, so they can injure their knees, they can injure their ankles, they can injure their thigh bones. And obviously, whenever you've got an injury and it is painful, so they would have a limp. So it's very important to ask about trauma, and then the nature of trauma would actually tell you what sort of injury it is. It can lead to muscular injuries, it can lead to soft tissue injuries, and it can lead to fractures as well. So in very small children, like around 2 years of age, if they've got a painful limp and they can't tell you exactly one of the weakest part of the bones where they can get a fracture is a toddler's fracture, which is the lower end of the tibia. So you have to x-ray that particular part. Sometimes the history is not clear, so you might have to do an x-ray, right, starting from the hip joint down to the foot. Ankle sprains, kids playing football, or those who are hopping, running, jogging, that can give them a painful limp. So in that particular case, the injury would be quite obvious. So you might see bruising, you might see swelling at the concerned area. So trauma is one of the most common causes of painful limb. Sometimes trauma is not the cause. It's usually the overuse. So these are those kids who are either playing regular football, or who are into regular athletics, or who are doing regular sports without any rest. So because they are using their lower limbs again and again, some of the ligaments can get stretched, and we call it overuse. So overuse of the muscles or the ligaments can give them a painful limb. So some of the common illnesses or the problems in this category is Osgood-Schlatter disease, which is a traction apophysitis of the tibial tuberosity, the iliotibial band syndrome, and some of the other muscular overuse, ligamentous sprains and strains are part of the overuse category of painful limb. Then if there is no history of overuse and there is no history of trauma, then it's very important to consider a very wide group. So in that particular case, a history would give you important clues. So if a child is unwell, he's got a history of fever and his history of red swollen joints, then you should be considering septic arthritis, and this is something which you should never miss, because this can have dire consequences if you miss that. So obviously these are the kids who would be unwell, who would be having a history of fever, who would be having like very swollen painful knee or any other joint. So septic arthritis is one thing which you should never miss. Leg calf Perthes disease, as I told you, which is the avascular necrosis of the hip joint, usually occurs in children who are 4 to 8 years old. And it occurs because for some reason the blood supply to the femoral head becomes less, leading to bone reabsorption, flattening of the femoral head, and that leads to a problem in the articulation of the joint and can lead to permanent issues with the hip joint. So it's very important that you diagnose it in the early course of illness, and you refer them to the orthopedics. Then the next category is Scfe, which stands for slipped capital femoral epiphysis. So this is basically what happens, that just below the femoral head where there is epiphysis, it can slip. It's most common in age group 8 to 14. Usually, so it's a disease of the adolescents. It mostly occurs in girls, obese girls, and can lead to painful limbs. So again, if you do an X-ray of the pelvis, frog view or the normal view, you might see that the femoral epiphysis has slipped. And again, it has got category 1, 2, 3, 4. Category 1 is usually treated with rest. Category 2, 3 and 4 have to be referred to orthopedics, and they might do a surgical pinning to hold the epiphysis in place. Then some other illnesses like psoas abscess. So psoas abscess is an abscess in front of the psoas muscle, usually secondary to purulent infections of the kidneys. Again, a child would be very unwell, he would be having fever, and obviously there would be other systemic signs and symptoms which would point towards that particular direction. Obviously the CRP and ESR and those things would be raised. So psoas abscess is another cause. Then another one thing we should not miss, which is rare, neoplasm, especially leukemia. So especially if a child has got a limb and he is quite pale, and there is either hepatosplenomegaly or has got repeated infections or has got bruising. So in that particular case, you should consider leukemias, because leukemias can present with secondary infiltration into the bone, and that can present as a painful limb. So obviously you need to do the blood test to see whether there is anything that points in the direction of leukemia. And one of the most common cause in young children is transient synovitis. So transient synovitis leads to, usually the history is that the child had got an upper respiratory tract infection, which actually settles on its own. It's a very mild one. But then one fine morning, the mother would say that the child woke up crying, and since morning he has not been able to weight bear on one side or the other side. No history of trauma, and usually it's a baffling thing. You do, if you are considering something more sinister like septic arthritis, something, you do blood tests and things. So all the inflammatory markers would be normal. So ESR, CRP, white blood cell count would be normal. If you do imaging, sometimes you might find a little bit of effusion in the hip joint, because hip joints are the most commonly affected in transient synovitis. But again, most of the time you won't find anything. So the blood test would be normal, the imaging would be normal, but the child is non-weight bearing. So that is usually caused by transient synovitis of the hip joint. Treated by rest and ibuprofen, and it's a self-resolving condition. Within a few days they start walking, and then they are back to normal. So this is the differential diagnosis of a painful limb. Now coming down to painless limb. So painless limb means a child who is limping but is not bothered by it. And usually the common causes of a painless is, number one is developmental dysplasia of the hip joint. So if during the child early development, if the hip joint where the acetabulum and the femoral head, they were not properly aligned, if that goes on for some time, then the joint is sort of a misformed, and that kids would usually have like length discrepancies, and they would be having a waddling gait, they would be having painless limb. So developmental dysplasia of hip joint in the early stage, if it goes unnoticed, can lead to painless limb in later infancy or in early childhood. Kids who have got cerebral palsy. So cerebral palsy leads to increased tone in the distal muscles, contractions and things. So one group of muscles might be affected than the other one, so that can lead to painless limb. And some of the muscular problems like muscular dystrophies can also lead to contractions in the muscles that lead to incomplete contraction and relaxation of the muscles, and that leads to a painless limb. So these are some of the common causes. There are other causes as well, but I'm not going into the details of that. I'm just like covering the very common causes which can be asked in the exams or which you confront in your clinical practice. So I think for most practical reasons and for most exam reasons, these are the differentials that you should keep in mind. So even if you've got, let's say, a case of a limping child in an exam and you are asked by the examiners to discuss what could be the causes of a painful limb and what could be the causes of the painless limb. So if you cover these things, these are more than enough to get you like full marks in your station. And even in clinical practice, these are some of the common things that you would come across in your practice, and this is what you should consider and what you should think about. Now, going on to the workup. So let's say you have got a child who has got a limb, painless or painful, and you have taken a full history. Now, before reaching the diagnosis, whether you call it Perthes disease, or whether you call it septic arthritis, or whether you call it psoas sepsis or anything, how would you reach that diagnosis? So the most important thing is imaging. Now, the imaging depends where do you think the problem is. So obviously, if somebody has got like focal pathology like a swollen ankle or something, so you would focus your imaging on that. So you would do an x-ray of the ankle joint, or you would do an x-ray of the knee joint. But sometimes if the history is not clear, you might have to do x-ray of the whole lower limb. But in case most common causes where there is painful limb or something, the problem is there in the hip joint, so you have to do an x-ray of the pelvis. The pelvis x-ray is either a normal AP view, or more preferably you can do a frog view. So frog view, if things are not picked up on AP view, they can be picked up on a frog view. So x-ray of the hip and pelvis is very important as far as our imaging is concerned. If you are considering systemic, like if there are systemic signs and symptoms, then obviously you need to check what's going on. So for that, some basic blood workup is needed, and that includes full blood count, including platelets count. That includes your white blood cell count. That also includes your ESR to see for any inflammation, and CRP. So again, a combination of the findings on these 4 parameters would give you an idea what's going on. Urine dip can be done. Sometimes limping can be because of reasons secondary to some issues like purpura, where you will find hematuria or proteinuria in the blood. So urine dip can give you some added information, though it's not specific, but it can guide your differential diagnosis. Sometimes you might have to do specialized tests like arthroscentesis, where you put a needle in the joint, and especially if you're considering septic arthritis, and you have to take the synovial fluid and send it for examination. And last but not the least, MRI. Sometimes things are not visible, like x-rays do not give you much information, like in ligamentous injuries, or in some cases like osteomyelitis. So you might have to consider magnetic resonance imaging of the bone, which gives you much clearer picture what's going on inside the bones, and even with the ligaments. So this is some of the workup that you need to do before you reach one of those differentials which we discussed earlier in case of painful or painless limb. So once you have reached a diagnosis, what are the treatment options? Again, treatment depends on the cause. So if it's obviously traumatic injury, or if there is a fracture, you need to put them in a back slab or in a cast, give them some painkillers, refer them to the fracture clinic, or just simply advise them rest if it's a soft tissue injury. If it's a severe one with angulation, like fractures with angulation, or if that is like Perthes disease or slip capillary femoral epiphysis, then these have to be dealt with the orthopedic. So obviously you have to make orthopedic referrals in such cases. Obviously, for overuse and where you don't find a reason, like transit synovitis or something, then in that case you just advise rest and ibuprofen for a couple of days, usually a week, and that's usually these are self-resolving conditions. So with rest and some painkillers, anti-inflammatory drugs, it should go away. Where there are some dangerous causes like septic arthritis, obviously you have to do arthrocentesis, take the joint fluid, see what's going on. You have to give systemic antibiotics, which means intravenous broad spectrum antibiotics, depending on the cause or whatever organism is causing that. And where you suspect leukemias, where the white blood cell count is very high and platelet count is low, and it's pointing toward a hematological disorder, then you have to refer them to oncology for further management. So in this short video, we took a case and we discussed some of the differentials for a limping child, whether that's a painful limb or whether that is a painless limb. And I hope you have understood the concepts, underlying concepts in case of a limping child. If you have liked my videos, do subscribe, give me a thumbs up and share it with your friends. And if you have got any questions, put it down in the comment section below. I will answer that. So have a good day. Thank you. Bye-bye.